Do you leave every doctor's appointment with more prescriptions and referrals and also more questions? Oh, friend, you're in the right place. I'm Kayla, registered nurse and personal medical strategist, and here every week we're going to work together to cut through the noise, connect the dots, and finally get you the real plan you deserve. Let's dive in. So, when one doctor tells you you're dying and then another one tells you you're good, who do you believe? Well, believe it or not, that is actually the exact situation that one of my clients went through. You see, she had end stage heart failure and was going to the cardiology clinic every week to get IV medications to help pull fluid off of her. Well, one week she went in for her routine medication, and her providers were concerned about her overall decline, and they actually brought in a palliative care nurse practitioner to talk to her. Um, and they basically gave her an ultimatum that either she needed to go home with hospice or go to the hospital because they were no longer able to manage her heart failure in this setting. So, of course, she was very panicked. The whole family was alarmed. She went to the ER, and the ER doctor, did some basic blood work, took a quick look at her, and was like, "Oh, you're doing pretty good." They were so confused and angry, and fortunately, they reached out to me, and the situation was clear as day to me. And this is what happens often in healthcare. When you receive conflicting medical opinions, they're not actually outright contradictions, but often it is a byproduct of siloed specialists speaking from their very narrow perspective or lens. So, in this situation, her overall heart condition was getting worse to the point they couldn't manage it in this capacity anymore. However, the emergency physician was only looking at her through the lens of emergency medicine. And even though her overall trajectory of her condition was poor, in an emergency medicine setting, she was able to keep up her oxygen level with just some supplemental oxygen to her nose. She didn't require any sort of mask to assist with breathing, didn't need to be on a breathing machine or a ventilator. And so, from an emergency medicine perspective, where the priorities are airway, breathing, and circulation, she was doing good. But that amount of nuance is often missing from clinical discussion. So, I want to give you some strategies when you're facing these conflicting opinions for your doctors, how you go about sorting it out and making sense of it all. So, the first thing is to clarify context. If ever you're getting conflicting information from your providers, very first question is to ask if they are looking at the whole, speaking with the perspective of the whole body or just one organ system. Or often, if it's not the organ body conversation, it's a time frame conversation. So the alternative there is, are they talking about overall prognosis and trajectory, or just how things are looking in this minute slice of time? To make that make a little more sense. The other time that I've seen this confusion and contradiction play out a lot is in my role as a nurse in the ICU. And oftentimes I'd have a patient, on life support who their overall trajectory was not looking promising. But you'd have that one physician who comes in and the family goes, "Oh, how's he looking, doc?" And they'd say something like, "Okay," or even "good." And maybe it's because, from yesterday to today, things hadn't changed much. And that is good in a sense. But the overall trajectory was not good. And most people don't know to suss out that kind of nuance. And this goes back to what I was mentioning a couple episodes ago, where most people are unaware how much burden of communication is actually placed upon a patient and their family, which really should be on the shoulders of healthcare providers. But I can't fix all of them, and I'm here to give you the strategies to work around it. So always clarify if it's about one system versus the whole body, and or if the recommendation is about an acute setting or the overall big picture prognosis. Now, if that clarification doesn't that clarification alone doesn't sort it out, what I really want you to keep in mind is that the question you should be asking yourself isn't which doctor is right and which one is wrong. But really, it's again about asking the context and making it all make sense within your overall clinical picture. And another element here that I want to talk about is that oftentimes when you are receiving conflicting medical advice, it's also at the same time you're being asked to make decisions, which how can you make a good decision if you don't even feel like you have all of the right information? And I have a process for that as well. Whenever you're going about medical decision making, I like a framework it's under the acronym of BRAIN, and it stands for benefits, risks, alternatives, intuition, and nothing. Those five pieces should be taken into consideration when making any medical decision. Now, benefits and risks you're probably familiar with, and oftentimes your providers will speak to these to some extent. If it's, let's say, we'll use a surgery as an example. So often they will tell you the benefits of the surgery, why they want to do the surgery, what is the anticipated outcome. They usually will mention at least some of the risks. Bleeding and infection are almost always ones, but typically there are other risks, and make sure that you're getting the full information there. Ask more questions. Always ask why a few layers deep. But there's other pieces to this decision making that typically get left off the table, and that is alternatives, intuition, or nothing. So, alternatives being what are alternatives to doing this surgery? Sometimes there aren't any, but it's always reasonable to ask about. I'm going to skip over to nothing because that to me goes hand in hand with alternatives. What happens if we do nothing? Or even if we do nothing for one day, 1 week, 1 month, depending on the situation, sometimes you can buy that time to be able to get more information and make more sense of it before making a decision. However, that time isn't always presented as an option. So remember to ask about hitting the pause button. And the last piece, coming back to the eye and brain, is intuition. Do a little gut check with yourself. What is your gut saying is the right or wrong answer? We oftentimes dismiss the value that intuition has, but really, side note, we're going to go a little segue here, or a little side path. Intuition is actually comes from stored memories in your brain. But your brain doesn't have the capacity to remember and catalog every single event that has ever happened to you in the form of language. Storing language, it's very resource intensive. So what your brain does, we have found, and go check it out. There's actually good neuroscience around this, is that your brain takes memories and almost like compresses them down to think about it like a smaller file on your computer that takes up less memory space. And when something is triggered that your brain remembers that event, what it tends to pull forward is the emotions and feelings of that event, but not the language or the visuals, the more vivid pieces that we tend to refer back to or point to as evidence or data. So you can be remembering something that has absolute relevance to what's going on now, and you just can't find the language around it. That's why gut feelings and intuition actually turn out to be correct a surprising amount of the time. And it's because it's not just a fleeting feeling, it actually is based on memories of other events that you've had before that you just can't access the language around. So don't forget to tap into your intuitive sense when you're making medical or any decisions in general. If my client's family had had that brain framework in that moment, it may have helped them from feeling so overwhelmed and panicked. Fortunately, they called me and we were able to work through it. Sometimes these strategies alone still aren't enough, though, to sort out the ambiguity or what can feel like conflicting opinions about what is going on with you or your loved one's care. And in that situation, it's ideal to ask for a care conference, particularly if you're in a hospital setting. It tends to be a little bit easier to get your providers all in one place. Um, it's always important when we're asking for something like that that we make sure that the way we ask really kind of dictates the outcome. So we want to make sure that we're using language that's very collaborative and keeps us out of this us versus them dynamic. So we do not want to say something along the lines of, these doctors can't get on the same page, and so we need to get everybody in the same room. But instead, I like to say something more along the lines of, I know we all want what's best for the patient, and right now, trying to determine that is challenging because I'm having trouble making sense of XYZ in relation to ABC. Can we please get the providers together so that we can talk this through all at one time and get clarity around the situation so that the patient can have the best outcome possible? Again, core principle, you catch more flies with honey than vinegar. So let's make sure we're pouring honey out of our mouths to our providers in a sense. Um, I'll be honest, it's very unusual for conflicting opinions or contradictions to survive a care conference like that. Because typically, what happens is when you can get everybody at the same table, and this person says that, and that person says that, and you can sit there and point and go, those two things don't make sense to me, that clarity will come up either from person A, person B, or sometimes, oftentimes they'll bring in a nurse or social worker too. Sometimes they can help bridge that gap. Personally, I have not actually had a conflict survive a roundtable discussion like that because it usually gets sorted right out right there. But if it does, please, it's a huge red flag. Pause any decision making as much as is possible until that clarity is reached. Um, if conflicting opinions remain despite a care conference, number one, make sure you're documenting everything. Take notes when you're in that care conference. Um, Request the records. Sometimes you can access them from your portal of what happened on that care conference, but make sure you've got yourself a good paper trail. I would also suggest that you clarify, if nothing else, what is an immediate priority versus what can we sort out later so that you can make the amount of decision making that needs to happen right now, let's make that as small as possible. And if you're still navigating conflicting medical opinions despite a care conference, that is a really good time to bring in a medical strategist or an advocate of some type. If you have somebody in your system or in your circle, a friend of a friend who has some knowledge, even, whoever you can bring into that topic, reach out to Herd for Life. We'd be happy to help you, but you gotta make sense of that, please, unless it is incredibly emergent, time sensitive, critical. Please don't make a decision without fully understanding it and resolving any of those conflicting opinions, because let's be honest, medical decisions can have lifelong implications, and it's really important to me, because I've seen what can happen. It's really important to me that you feel like you have all your questions answered before making a decision that has um, incredible ramifications behind it. So I hope that this was helpful today. Lots of tactics there. I want to just recap them for you briefly. So often, most of the time, conflicting advice is stems from looking providers speaking from different perspectives as opposed to outright medical contradiction. So always start by clarifying if these statements are about one body system or the whole body, or if this is a topic of an acute slice of time versus big picture prognosis. Um, Figure out the context that each provider is using as opposed to trying to figure out who is right and who is wrong. If you have unresolved conflicts in medical opinions, that is a huge red flag. Please, as much as is possible, pause decision making until clarity is reached. If having those individual conversations and asking about perspectives doesn't give you the clarity that you need, request some care coordination, a conference, however they like to call it. Always make sure that when you are requesting those things like that you're keeping your language very team oriented and collaborative, and not slipping into kind of the default of an us versus them dynamic. And if conflict remains, reach out to your resources, either in your network or professionally. Um, Document everything and clarify immediate priorities versus long-term things. I hope this was helpful for you. As always, please feel free to reach out. That is exactly why we are here. Oftentimes, these kinds of conversations, we can sniff out within a few minutes of what it is and make sense of it for you. So, all right, well, stay tuned and come back next week. We'll be unpacking even more tactics for getting through the healthcare system. Don't you go to another appointment unprepared. Head on over to herdforlife.com/guide and get my free doctor's appointment prep guide so you can start getting the answers you need and get off the medical merry-go-round. I'll see you next week.